Your CNOS Healthwatch on Siouxland News.
Many times when you think of scoliosis, you might think of the elderly, but another type of scoliosis affects the young. Siouxland News reporter Katie Link caught up with a CNOS spine surgeon to learn more.
Idiopathic scoliosis, a lot of times we're checking just for an abnormal curvature in their trunk. So in this plane, it kind of goes like this type of curvature.
Dr. Wade Jensen, an orthopedic spine surgeon at CNOS, sees a variety of scoliosis patients every year.
We call it adolescent idiopathic scoliosis because we don't know exactly the cause. However, the Scoliosis Research Society has really made some good progress in figuring out the gene that actually causes scoliosis, and now we have a genetic marker that we can use.
In addition to finding the genetic marker, the Scoliosis Research Society has developed a painless test to see what type of scoliosis you have.
Actually a mouth swab, and we can send that in and you can actually link that to what gene, whether you're going to be a progressor or non-progressor.
You won't find this in the clinic quite yet. It's still used mainly in research facilities. That's why many times schools perform tests for scoliosis in early adolescence. 12
to 14, when they're really shooting up, those are the times that you see their curves progress pretty significantly.
It is especially important to monitor during a growth spurt.
So if you can put them in a brace during those times, you can oftentimes prevent them from having or needing a surgery down the road. So that's the importance of seeing them fairly early, is so you have the opportunity to put them on or put them in a brace.
In some cases, if the curvature progresses to a certain point, it can affect vital organs and doctors have to operate.
See, the bulk of his curve is actually where his heart and lungs are. So if you did nothing for this curve, he actually would probably progress his scoliosis as he got older to a point that actually affects his heart and lungs, his breathing, and his circulation. So,
luckily, most teens don't need surgery if treatment is successful.
The bulk of idiopathic scoliosis don't need surgery. I probably follow 20 or 30 patients for every one patient that needs a surgery. So there's a lot of patients that I follow that never ever need surgery at all.
For Siouxland News, I'm Katie Link.
Now, Dr. Jensen says many times the parents are the first to see something that's just not quite right in their child's back. That's the time to bring them in for early monitoring and for treatment.